Hey y'all, welcome back. It's Tuesday, so you already know, new podcast episode. And this week we have a guest. So we have Britni, Dr. Britni Barber, and she's our first DPT, y'all. I think this is exciting that we are including Black women of all professional matters, all Black doctors. Literally, the name of the organization is the Black Doctor. So we should be inclusive, right? Not just physicians, all doctors that are working, especially clinically. So welcome, Dr. Britni.
Thank you for having me.
Of course. So let me tell you guys about Britni. She, like I said, is a doctor of physical therapy and pain-free performance strength coach. She grew up in Maryland, earning her bachelor's degree from Towson University and her doctorate degree from the University of St. Augustine in Florida. After graduating, Britni was a traveling physical therapist before settling in Denver, Colorado, where she now resides. Britni started her practice Rise Performance and Physical Therapy 2 years ago. Her business started online, leveraging the power of social media and quick evolution of virtual and online services during the pandemic. It's pretty smart. Britni also started a local practice with 2 locations in the Denver area. Britni is passionate about helping active adults find movement freedom in their life, whatever that looks like to them. Through both her online coaching services and clinical practice, Britni is able to help active adults eliminate pain and improve overall performance so they're able to do more of what they love without their body being the thing that's holding them back. Can we talk about that? Yes. Welcome, Dr. Britni.
Hi, thank you for having me.
Awesome. So I'm going to ask you to talk about your training because us as physicians live in a bubble. And so we have a tendency to not be aware about your program, what you went through, because there's a lot of similarities, obviously, and the journey was the same, essentially. So
hmm
tell us about it.
Yeah, so the road to becoming a doctor of physical therapy starts in undergrad. You usually go to an undergraduate program that's focused in some sort of either health or science background. You don't have to, but I would say the most common undergrad degrees are either exercise science, kinesiology, biology, or psychology, even. So a lot
Yeah.
of the people that end up going into PT school have some sort of background in one of those fields.
Yeah. So my bachelor's degree actually is in exercise science because I thought I was going to be a physical therapist.
Oh, yeah. So that's usually where most of us start. And then from there, you apply to PT school, usually like your junior-ish year of undergrad. And there are some requirements to do before you apply. So getting observation hours and shadowing and working in the field as a volunteer or something like that. Once you apply and get in, you usually start right after the summer after you graduate, going to PT school, which is a 3-year program. So it's a clinical doctorate degree. It's 3 years, and total you're in school for 7 years from bachelor's to doctorate.
That's awesome. Seeing as I was an exercise science major, I know the rigors of that undergrad program. Woo. Um, okay, so you did your training, you got out. What was your next step? What did you do after you graduated?
Yeah, so I graduated and immediately went into doing travel physical therapy, which for those who are unfamiliar with that, they usually know what travel nursing is. And it's the same exact thing. Working with recruiting agents or recruiting companies to find contract locations anywhere in the United States. I think they even do some providences and things like that. But you're working with a company that essentially finds you contracts to work at for anywhere from 3 to 12 months. And you can work in a variety of different settings. You can work in schools, hospitals, you could work in outpatient facilities or clinics, skilled nursing homes. But there's a lot of opportunity to see the world. They say travel teaches you a lot about what you do like in your profession and what you don't like in your profession.
Absolutely.
So I ended up doing travel therapy for a little over a year. I graduated end of 2018. So I did it up until 2020.
Wow. Until the pandemic, sailed right into
Mm-hmm.
that. What was your favorite place that you went to?
Scottsdale, Arizona, I think was one of my favorites. I really like being out there. It was a different type of climate and humidity that I grew up on the East Coast, so very humid. And it was a very different environment, very pretty. It was like the first place I lived or had visited where I saw mountains. So it was totally different from where I grew up.
Yeah, we have very similar journeys because when I did my fellowship for global health, we went to Navajo Nation and my first site was in Arizona. And I had never been to the Southwest before moving
Yeah,
there.
me either. Until I went
Yeah.
for travel. Yeah.
Yeah, totally different lifestyle, culture, I feel like is very different.
Oh yeah, for sure.
Yeah. Yeah. So, what did you find like you didn't like about it? When you said it helps you define what you like and what you don't like, what did you find that you did not like?
Yeah. So when a company asks for a travel PT, they're usually short staffed, super
Yeah.
busy. They need help. That's why they're hiring a travel PT. And unfortunately, that comes with a lot of the things that can lead to burnout. Seeing up to 5 patients in 1 hour, that was the most I ever got
Mhm.
put on my schedule, was 5 people in 1 hour, which, if you can imagine what physical therapy involves, seeing 5 people in 1 hour isn't conducive to giving good quality care at all.
Mhm.
So the amount of people I was seeing, my caseload, my schedule, things like that, were things that I didn't love about the facility, some of the facilities I was in. I also was getting asked to come in early, stay late, work weekends when there wasn't really, for one, that doesn't lend to a very good work life balance. But two, I also wasn't getting compensated really for doing any of that. So, on top of taking away from my time that I have to recharge and do things that like fill up my own cup, I also wasn't getting compensated for any of that. So, that was also another downside, or some of the things I experienced that kind of taught me what I didn't necessarily love about the profession. Because what was shocking to me is that it was so normalized, all of it. Okay, you're seeing 3 to 4, sometimes 5 people in 1 hour, but that was considered normal. You're coming in late, you're or staying late, coming in early, working weekends, and it just seemed like that was normal. And I was like, oh, okay, like I didn't realize that.
I, yeah, I agree. I think that there's a huge problem with the fact that this behavior is normalized because essentially it's bad behavior, right? Like you are
Yeah.
not taking care of yourself if you're constantly just extending and extending how much you can do within the same time frame and for the same salary, because for real they're really not paying you extra.
Mm-mm.
So
Nope.
ridiculous. And then you feel bad about speaking up again about it because everybody else is doing it.
Yeah. And I think that just from how I was raised, I was taught to stand up for yourself, voice something if you're like unhappy about something, but always in a respectful way. But that I was taught that I'm allowed to say something. But I
Mhm.
got into this field, and because everyone else around me was just accepting it, it almost made me feel like I would have been like the bad guy for saying something. So then it almost put me back in my shell where I was like, oh, everyone else is accepting of this. Like, I need to be accepting of it too.
Yeah. And I think it's also harder because as a like I'm a traveling doc, so I understand like the showing up and being the new person, like or
Mm-hmm.
a short-term person. So you're thinking I could either ride this out and just choose not to renew, or I don't necessarily want to be the first person that comes in and is disruptive, quote unquote, right? Because of how things are structured. So looking back at that moment, because I think after that you moved into your own practice, correct?
So I took a job for a year with another company when COVID hit. A lot of
Mhm.
the travel jobs, immediately when COVID hit, a lot of the travel jobs went away for a while. Eventually, when we knew COVID wasn't going to be a quick 2 or 3 month thing, travel jobs started to come back, but there was so much uncertainty with them. There's already uncertainty with being a travel healthcare worker or a travel doctor. Your contract could get canceled. Some say they'll give you a 30-day notice, but does that really happen? And there was just even more of it during COVID that I was like, I don't want to travel halfway across the country for a contract that could get canceled. So I ended up, yeah. So I ended up just saying, okay, I'm going to take a job with a company in Boston. I was in Boston when COVID hit. wasn't too far from Maryland. It was actually the closest I had been to home in a while. So it was a 6 hour drive home. I was like, okay, I'm going to just chill here for a while and see what happens. So I ended up taking a job with company for a year. And, it was all the things that they said they were going to do that I wanted. It seemed like my dream job. And then it was almost the same thing. Like I got there and all these things that were going to be promised weren't being delivered. And similar experiences that I had with doing travel therapy were creeping back up into this job. Seeing multiple people per hour, being asked to stay late and come in early, not getting compensated for it, being asked to do events without being compensated, just all of those same things that I had, all of the issues I had with doing travel therapy. I was like, okay, it's not just travel therapy because it's happening in this job too. And this is a salaried full-time job.
Yeah, it's the underlying culture of clinical practice, regardless as to whether it's inpatient, outpatient, travel, or permanent. The culture is the culture. And we, I think, often underestimate how pervasive the attitude is that people should be willing to work more or do extra projects and stay
Mm-hmm.
late without compensation because it's for the betterment of the patient, right?
Yeah. Yeah. And I think that's one of the main reasons why it gets slid under the rug so much, or we feel bad for saying something, because at the end of the day, it's no, you signed up to help people. You signed up to be this person that is there for everyone and helps people through whatever situation they're going through. And so it's almost that gets put back on us in a way, almost, no, you signed up for this.
What do you think is wrong with that argument?
The argument that we signed up for this, so it's okay for us to be asked of this.
Yeah,
That
things, but
I think the situation with that, or the issue with that, is that yes, most people in healthcare, almost all of us, like we signed up for this because we want to help people and we want to serve, but we can't help people and we can't serve if we're being so thinned out. We're just being stretched so thin. Then it
Mhm.
becomes a matter of, am I really helping people? Am I really showing up the best way I can to help you work through whatever situation it is that you need help with? Because that's something I began to see when I started practicing. I was like 2.5, 3 years in, and I started to realize I'm not giving good care. I'm giving good care, but I'm not giving great care. And I started to notice on those rare occasions where I had someone cancel and I had the full 45 minutes with one person, I got to see everything that I could do for them in that 45-minute session when it was just me and them, that I was like, wow, this level of care that I'm able to give someone when I have 30 to 45 minutes to just sit down with them and listen to them and create a plan that is really truly individualized to them, I'm able to provide such a better experience to that patient that I'm not able to do on a normal day-to-day basis.
Right. No, literally. And I think there's a cognitive dissonance there, right? Of knowing that you're not really doing a great job, but you're trying to do a great job and the timing is
Mm-hmm.
not allowing it, but you don't feel like you control your schedule.
Right.
So, did you have a breaking point? Did you have a moment where you're like, this is absolutely not for me? Or, yeah. So, tell us about that.
Yeah. So I think it was when I took that job once COVID hit. And I was like, okay, I'm out of travel therapy. I'm with this full-time salaried position job. And they were promising me everything that I said I wanted in my career and in my profession. And then I started to see that it wasn't like that at all, and that it was still very similar to travel therapy, my experiences there, despite one, them making these promises that actually weren't being fulfilled, and stepping out of the travel world into something that was supposed to be more stable, and it still wasn't. And I think that's when I began to get really frustrated and really burnt out. And so I started sharing about physical therapy online just for fun, not really wanting to or having expectations to make something out of it when I started. It was more just a way for me to reconnect with something that I liked doing, that I had been questioning whether or not I even wanted to do anymore. There was times where I thought about leaving the profession as a whole. And this was something that I could do that allowed me to reconnect with why I became a PT and just share about physical therapy online. And then that's when I started having people reach out to me and say, hey, do you work with people virtually? Do you have any virtual services? Is there any way I can work with you? And I was like, okay, like, wait, maybe this can be something. Maybe this is a way for me to do what I love and help people in a way that isn't frustrating, doesn't lead to burnout. And I was like, give me a month to figure out all the logistics. And about 4 weeks later, once I had everything set up, I started doing online coaching.
That's impressive. You're going through this transformation in the sense of you realize this is not the system that is going to work for you. But more than that, there's an emotional toll of not being able to practice the way you want to practice. That loss of fulfillment, that loss of autonomy. I think you described that pretty beautifully in being like, this is what I ended up doing. And seeking that, I went to social media because you wanted to connect directly to people. And that allows you to do it on your own time, not rushed, in a better quality way. And I feel like a lot of doctors do that. They try to find some other project to supplement the deficit that is left by not being able to practice the way they want to practice.
Yeah, definitely. I would definitely agree with that.
Yeah. I love that you actually did it though, because a lot of people are like, oh, I should do this. And oh, people are asking me but you actually did it. So what was for you the thing that was like, oh no, I can definitely do this?
I think it was when I just started to see how much happier I could be, how much more of a difference I could start to make in people's lives. And yes, it's scary. There is a lot of uncertainty with it, especially when you're first getting started. But I think I've always been a little bit of that person who's almost like where there's a will, there's a way. Like, okay, this might not work on the first try, but then we can pivot, figure out a better solution, a better system, a better way to approach something. And I think I have a little bit of that like drive and ambition built into me, which really did help to allow me to succeed when I started venturing into other opportunities within my career, my profession that weren't the standard or the normal route that most people tend to go.
Yeah. I think it's even more than that because I would say most doctors have stamina and most of them have some kind of perseverance, right? Because getting into any form of clinical practice is not easy. We all are on that path of, yeah, we're going to do this and we're going to help the people. But so many doctors stay in these environments.
Yeah.
So many gripe about it. I talk to people all the time that are griping about it, right?
Yeah.
But they don't actually find a solution. So I'm I guess I'm focusing on it because I think there's just something else that makes you more successful in your ability to pivot. And that's not something that everyone has. There's a
Yeah.
lot of doctors that have perseverance. There's a lot of who are like, yeah, there's a will, there's a way, because they're doing it and they're doing it on behalf of their patients and they're making miracles happen, but they don't also find a solution that serves them. And the first thing you said was, I saw another way that would make me happy. And I feel like that is a moment, recognizing that your happiness is also important in the provision of services. Yes, I can help a lot of people. It's going to be great, but I also deserve to be happy.
Yeah. I think that's absolutely true. I think it is more about seeing almost the lifestyle, seeing the vision of not only where you're at now, but what do you want your life to look like 5, 10, 20 years from now? And being able to say, can I picture myself doing what I'm doing right now for the next 20 plus years? And for me, it was an immediate no, I can't.
I feel you. Yeah. Immediately no. Like, what? 20 years of this? I'm not
No,
even happy today.
I would have made it.
No, not at all. And that's an important thing also to acknowledge because there's not that many Black providers, right? There's not that many female providers. So when you combine it down to like a Black female clinician, we're super rare. And if our ultimate goal is to help people, there's multiple ways to figure that out. And it doesn't involve the self-sacrifice that cuts your career short. I love to emphasize that point because you're not serving anybody if you end up burning yourself out and therefore quitting.
Yeah, exactly. I don't remember the exact statistic, but there was a large amount of people who ended up leaving healthcare in general
Mhm.
during COVID. And
Oh, yeah.
I saw that directly when I was still working in the clinic under another practice. We were struggling and struggling to find people to replace the people that were leaving.
Yeah. The pandemic definitely was the straw. It was more than a straw. It was like the whole haystack, but it definitely was breaking back. So
Oh,
people who
yeah.
were on any kind of border, any kind of fence about leaving or staying, I think it definitely made that decision for a lot of people.
Oh, yeah. Because I feel like I was one of those people. I had one foot in the door, one foot out the door, and then
Mhm.
hit, and I was just, okay, time to go.
Yeah, definitely pivot away from the toxicity. Okay, so you started your own practice. Tell us about that. Tell us about your practice. Tell us about what you're able to do there.
Once I moved to Denver, I ended up actually taking a job with another company for 4 months when I first got here.
Mhm.
And it was better than the clinic setting. It was outpatient in the home, traveling and treating patients in their home. It's different than home health because these were a little bit more like higher level functioning adults, but it was better because I was at least one on one instead of seeing multiple people an hour, which was better. But it still had the same, it still stemmed from the same background. It still had all the back end issues that working for the traditional bigger clinic settings had.
Mhm.
So it got to the point after they begged me to move out to Colorado a month early. They're like, please, we need help. We need help. 4 months later, they were like, wait, we actually don't have enough people to keep you on. So you can either stay on and work PRN, or if you want to go ahead and leave the company, we understand that as well. At that point, by the time December hit, I was getting like maybe 10 hours a week. And I was like, this isn't going to do anything for me. So I think as of January, I'm going to leave. So I ended up leaving in January. I was deciding what to do because I had my online side of my business that was doing pretty well. And it wasn't enough for me to like fully jump into that and feel comfortable doing that alone. So I was deciding, laying out all my options of what I was going to do. And I did go on an interview with another company, got the offer, and then I thought about it and I was like, I can't take this. I can't go back into the clinic setting full time. I can't go back into that environment once I've already had one foot out the door and I already had an experience of what it was like to somewhat be out of that. So I thought about it and I was like, I always wanted to have a clinic, like an actual in person clinic. And it came sooner than I thought it was going to. It was a situation that I wasn't expecting, but it was almost the perfect situation to start. So I didn't end up taking that job that I got offered and instead just ended up doing some contract stuff here and there while I was getting my practice up and running. Again, with wanting to keep overhead low, with jumping into this new for the first time, I ended up subleasing space inside of a gym. They had a private room and they didn't have anyone using it. So I was able to set up in there and had all the equipment that I needed to use and was able to start my practice within 3 to 4 months after
That,
leaving that first job.
yeah, that's really impressive. And I love that you had that moment of, okay, let me see if I can find something else while I create this transition, going through the interview, because I've also done that, going through the interview process, getting an offer letter and being like, ugh, this is just not it. Not
Yeah.
this.
Yeah. Exactly. And so some of the things that I saw when I went on that job interview, when I saw the clinic space, it was the same thing I had been seeing for years you're seeing and working with multiple people per hour. The equipment that they're using is pretty outdated. You're not able to give the true care to the patients that they're going to need. And I was like, I can't do that. So those are all the things that I wanted to make sure that I put emphasis on when I started my practice. So being able to be in a space, that's why the gym worked so well for me, because Colorado is a pretty active community, but the type of people I work with in general are people who usually value movement in some way in their lives and have goals to get back to some sort of activity. And so that's the thing I was seeing too, is that traditional physical therapy in the insurance-based clinic model just gets you back to function. Can you walk without pain? Can you go up and down stairs without pain? But a lot of the people I work with, that's not enough for them. They don't want to just be able to walk and go up and down stairs without pain. They want to be able to sit on the ground and play with their kids or chase them in the backyard without worrying if it's going to flare up their symptoms. Sometimes they do hobbies and activities on the weekends that are more active, and they want to be able to do those without this looming fear over their head that their symptoms are going to come back if they try to enjoy life again. So being in a gym setting, being in a facility that had a lot of equipment available that my clients and I could use to really help not only get them functional, but get them back to actually doing what they love to do was important to me.
Yeah, that's a big deal. I like that distinction of it's more than just the baseline recovery that you're offering. You're literally trying to get them back into the types of activities of daily living, if you will, for a lack of a better term, but things that they really enjoy doing and really do improve quality of life. It's not just being able to walk, it's literally being able to sit on the floor with your kids. That's a huge deal, especially if your
Mm-hmm.
kids are young, because they're all
Yeah, for sure.
my best attempt to summarize is placing your own feelings as one of your guiding principles, right? Placing your happiness, your comfort is pretty high. And that also is placing the quality of care you provide to your patients, being able to spend a certain amount of time with people, being able to explore their goals and really determine what their best outcome is, not the minimal outcome. And
Mm-hmm.
then just making sure that the space that you're providing and the equipment you're providing is top quality. Those are pretty significant principles to have and to maintain. And at baseline, that's what you're making your decisions from.
Yeah, definitely. And I think one of the really cool things that ties in almost everything that you just mentioned is noticing the duration of the plan of care that I saw when I was working in insurance-based practice in the clinic setting versus in my own practice. It's like they were pushing 3 visits a week for 8 to 12 weeks. So they're coming in like 25 plus sessions where that's not necessary. And to now be able to take someone through a full plan of care in 6 to 8 visits versus 25, and they're getting the same, if not better, results from that. Just ties in the being able to be one-on-one for an hour, being able to support my clients throughout the week versus 20 minutes once a week while they're in the clinic, and having high level equipment and skill available to them to help get them better faster, if not let them be in a situation where they're better off performing at a higher level than they would have been elsewhere.
That is awesome. Who doesn't want better, faster results? Right?
Exactly.
Literally, the whole that's like a measure of satisfaction. Can I do this better and faster? Yes, sign me up, 1000%. Okay, so who do you serve right now? Now that you're in Colorado, you're running your own practice. Who's your primary patient population?
Yeah. So for those who don't know a lot about the community here in Colorado, it's a very active community, which I love. I moved here a little over a year ago now, and this just fits in with how I like to live my life. So a lot of the people I work with are active adults in some capacity, but that does range on a spectrum from, like I mentioned, parents, moms who are just needing to keep up with the day-to-day life of taking children to practices and doing activities with them and things like that, to the desk worker who has to sit for 6 to 9 hours a day and then wants to go to the gym or go to a class or something like that, and they're having trouble because of the lifestyle that they live because of their work.
Mhm.
So working with them to incorporate more movement throughout the day, small movement breaks that will help them feel better at the end of their workday, to the person who is more of the weekend warrior type adult who works during the week but loves going up into the mountains on the weekend or playing on rec team sports and things like that, all the way up to the person who moves on a higher level on a day-to-day basis. So anywhere on that spectrum, the person I work with just values movement in their life, understands the importance of it, and knows that they need to do something, but they don't quite know what that is or how to get there. And so that's where I come in.
Beautiful. And that's in person or virtual? Because you mentioned you have some physical sites and you still do virtual as well.
Yeah. So that's mainly for my in-person practice here in Denver. For
Mhm.
online, it's very similar, but a little different. So any of those things I previously mentioned could be the same type of person that starts working with me online as well. Obviously, they can be located anywhere though, which is the cool part about it. They don't necessarily need to be here local to Denver. But another big thing I see on the online side of it is that person who has tried traditional physical therapy before, or they've gone through physical therapy and they have seen success from it. But again, they're like at that point where they're like, I'm functional, I'm fine, but I'm not where I want to be. And so that's where a lot of the stuff I do online can be helpful for that person who has gone through traditional physical therapy in the past, hasn't seen the results they're quite looking for. Maybe they feel like they're 70 to 80% better, but that just doesn't feel good enough for them. They want more. And so that's
Mhm.
a big target population of who tends to work with me virtually.
Nice. Okay. So if there are two potential listeners on this, right? There's people that actually might need your direct services. And then there's a lot of people who could possibly refer for your services. So, is there any limitation on who can refer to you?
No, I would say if someone is in a lot of chronic pain, then I wouldn't necessarily recommend them for virtual services just because they probably would benefit from someone being able to be there with them in person.
Mhm.
So that would probably be one of the only limitations. But with online, I'm still able to do virtual movement assessments, which we got really good at during the pandemic, and have my clients move and demonstrate certain things that tell me a lot of information that I need to help create the best program for them. I work a lot with orthopedic based injuries. So that would maybe be another thing, is if it's more like neurological or obviously like a pediatric case or anything like that, that I would probably defer to a different source, but mainly orthopedic injuries in adults who may have pain or just want to improve their overall performance level. But I would probably also stay away from, for online, more of those severely chronic high pain level cases.
Yeah, totally get that. Okay, so where can the people find you?
Yeah, so the best way to learn more about the style of practice that I do and who I am as a person, what I value in my business, is through my Instagram. That's where I share the most about me, my business, and what's going on inside of my business. And my Instagram, Britni BDPT, but Britney spelled a little different. So
I'll put it in the show notes so everyone can see exactly how she spells Brittany. And actually, it'll be a link so they can just click from the show notes directly to your Instagram.
okay, perfect. Yeah. So
They will
my
find you.
yeah, super easy. So my Instagram is going to be the best way to just connect and learn more about me, learn more about my business. If you're looking to actually reach out for services or even just information about my business and how to work with me, my website will be the best place to go for that, which is riseperformanceandpt.com.
Perfect. Okay. So, like I mentioned, all you guys listening, those are going to be in the show notes. So you can click, you can follow Dr. Brittany on Instagram, you can look at her services. I'm sure some of y'all have patients that need her services. So just go ahead and click the website or send your patients to that website. Anything else you want our audience to know or anything else you want to talk about before we hop off?
Yeah, if there's anyone listening who is on the side of possibly needing services that I provide, I would love to just tell you that where you're at right now and how you're feeling, if you're like, I feel stuck, I feel like there aren't any other options, I feel like I've tried everything and nothing seems to be working for me, not all physical therapy is created equal. There are tons of different backgrounds, tons of different specialties, tons of different styles of physical therapy. And it's about finding the person that you trust and the person that works for you and your lifestyle. I've had people before who have tried physical therapy once and then they write it off forever. And there's such a variety in the type of experience you can have with physical therapist in general.
Thank you for saying that. I definitely don't think people know that or appreciate that.
Yeah, for sure.
And it's the same thing with any specialty, any service that you're going to, right? If you're looking for a therapist, you want to interview multiple therapists, right? If you're looking
Exactly.
for anybody that's going to be involved in your life in any way, you want to interview multiple or talk to multiple because literally what didn't work for you with someone else, there's someone who can do it better. So, love
Yeah.
that sentiment. Awesome. Thank you so much for coming on. It was an absolute pleasure to learn from you and to talk to you.
Yeah. Thank you for having me. It was really great to be here.
Awesome. Okay, guys. So check the show notes and follow Dr. Britni and look at her services because I know y'all got some referrals. So send the referrals to Dr. Britni. Yay. All right. Thanks.
Thanks. Bye.